Hello again. This is Deborah Bean with the Mount Crescent Ski Patrol of the Rocky Mountain Division of National Ski Patrol. We're going to be talking about water emergencies from Chapter 29. The objectives, compare and contrast dry drowning and wet drowning, describe the physiological response of the mammalia diving reflex, define the following terms: submersion injury, arterial gas embolism drowning, decompression sickness, and near drowning. We're going to describe the following gas laws: Boyle's Law, Dalton's Law, and Henry's Law as it relates to water emergencies. We're going to list the 3 types of barotrauma and indicate their causes, and list the 9 ways in which a water-based emergency may be prevented. List the signs and symptoms of the following water-related emergencies: arterial gas embolism and a decompression sickness, and describe how to manage a patient who has suffered a water-related injury. The topics we'll go over: the anatomy and physiology, the common water emergencies, preventing water emergencies, the assessment and management, and chapter summary, as usual. Okay, our case presentation is we found a young man is found floating in the lake near shore. You can see rocks on the bottom. No one admits to seeing what happened, although his friends pull him to the shore. He is unresponsive, cyanotic, not breathing, has a weak carotid pulse, and a large gash on the top of his head. So do you think it's advisable for the person to be removed from the water before a backboard is available? What equipment do you typically available at local areas where swimming is a popular activity? Consider that as you're planning how to help this guy. Okay, the anatomy and the physiology of breathing means we're going to start looking at some data regarding drowning first. Drowning is the 5th leading cause of death in the U.S. and the #1 cause in children besides congenital defects. According to the CDC, 10 die each day from drowning, and 80% of those who die are male. Besides death, victims suffer brain injury and lung tissue damage, and during the breathing process, the diaphragm and accessory muscles contract, and air enters the naso and oropharynx, passes the vocal cords and larynx to the trachea and bronchioles. At the site of the alveolar, gases are exchanged by diffusion. Note that external respiration is when oxygen and carbon dioxide are exchanged between the red blood cells and the alveoli. Internal respiration occurs when O2 and CO2 are exchanged between the body's cells and the red blood cells. That's one of those test question kinds of distinctions, so keep that in mind. External respiration is when oxygen and carbon dioxide are exchanged between the red blood cells and the alveoli, and internal respiration occurs when O2 and CO2 are exchanged between the body's cells and the red blood cells. External respiration happens when O2 is transported to the cells of the bodies by the red blood cells in the capillaries, and CO2 is returned to the lungs. The pathophysiology of drowning is complex and involves several body systems, primarily the cardiovascular and respiratory systems. When someone is underwater, he or she reflexively holds his or her breath, and depending on the person, it can do this for seconds to minutes. When oxygen levels in the brain begin to diminish, panic sets in, and the patient may aspirate water as he tries to get more oxygen. As a result, the larynx may spasm. This is called laryngospasm, and it completely closes the airway. Not having sufficient O2 in the brain causes the person to lose consciousness and induces electrical disturbances in the heart, leading to cardiac arrest. As the airway muscles relax, water flows into the lungs. Wet and dry drowning will not likely be an issue for OEC techs, but rather you will treat the results. You're probably aware of people submerged in water surviving for long periods of time, especially children. This very effective protective response is the mammalian diving reflex. In extremely cold water, the peripheral blood vessels tightly constrict, shunting warm blood to the heart and brain. At the same time, metabolic processes in the heart slow significantly, reducing the oxygen demands and conserving available oxygen. The gas laws are mostly relevant to scuba diving or deep snorkeling applications, but since they are included in the chapter, they are worth mentioning. Boyle's Law, Henry's Law, and Dalton's Law are factors in water emergencies. You can check out their complete definitions in page 923 of your book. but Boyle's law simply states that when pressure decreases, the volume of gas increases, and vice versa. Henry's law simply stated is, at high pressures, more gases will dissolve in a liquid, and when the pressure decreases, the gas exits the liquid to form bubbles. And Dalton's law states that the overall pressure of a gas is made up of the pressure of each individual gas added together. The common water emergencies that you might encounter are submersion injuries, barotrauma, nitrogen narcosis, swimmer's ear, breath holding, trauma, marine animals, and aggravation of existing conditions that the patient may have. All right. Okay, we'll go back a little bit here. Consider factors that can contribute to drowning, such as fatigue, panic, entanglement in something like a net or seaweed, alcohol or drugs, stomach cramps, not being able to swim, or falling through ice, to name a few. Consider that patients who suffer from seizure disorders frequently drown in bathtubs. Diving accidents involving the head or neck being struck contribute to drowning. With submersion injuries, remember that only the airway needs to be submerged. A person can drown in 2 inches of water. Imagine a puddle in a parking lot. The drowning process. The pathophysiology of drowning is complex and involves several body systems, primarily the cardiovascular and respiratory systems. When someone is underwater, he reflexively holds his breath, and depending on the person, they can do this for seconds to minutes. When oxygen levels in the brain begin to diminish, panic sets in, and the victim may aspirate water. He tries to get more oxygen. As a result, the larynx may spasm, completely closing the airway. Not having enough O2 in the brain causes the person to lose consciousness and induces electrical disturbances in the heart, leading to cardiac arrest. As the airway muscles relax, water flows into the lungs. Drowning, simply put, is a condition that occurs when someone inhales water through the mouth or nose and gets it into the lungs. There seems to be some discussion regarding drowning, near drowning, and secondary drowning. And essentially these refer to if and or when a person dies after a submersion injury. Aspiration of salt water would cause fluid to leave the bloodstream and enter the lungs. Aspirating fresh water would cause the fluid to move from the lungs to the bloodstream. Either way, an adult male would have to aspirate 7 liters of water for either of these events to occur. The temperature of the water may be more important than the salinity of the water, but studies have shown that the most important factor is duration of submersion. In most cases, submersion for longer than 10 minutes reflects a very low likelihood of good outcome. Another concern might be the millions of suspended particles, pathogens, and organic matter that might be aspirated into the lung tissue, causing more damage to the lungs. Remember that only the airway needs to be submerged, and this is why babies can drown in a bathtub. With drowning, there's immediate death. With near drowning, the patient survives for more than 24 hours before he or she dies. And in secondary drowning, death occurs within 24 to 72 hours after submersion. Remember that the temperature of the water and the saltiness of the water affects the patient. And consider that aspirated particles and pathogens contribute to problems with drowning. With barotrauma. So if I join ski patrol, what does barotrauma have to do with winter sports? Just a reminder that OE skills are portable and year-long. You will be in a variety of environments and should be familiar with many possible problems. Generally, we are concerned about barotrauma and scuba diving, and it refers to injuries caused by increased air or water pressure, such as during airplane flights or scuba diving involving air-filled body cavities. Barotrauma of the ear is common. Generalized barotraumas, also called decompression sickness, affects the entire body. A decompression sickness results when a sudden decompression causes nitrogen bubbles to form in the tissues of the body. The bubbles occur in divers who move from deep water towards the surface where the surrounding pressure is lower in too short a space of time. Think of opening a can of soda pop. It is often called the bends. Bubbles move from the bloodstream into the tissues, causing muscle and joint pain, or a bubble can become an embolus and block critical blood flow. Someone suffering from decompression sickness needs treatment in a high-pressure recompression or hyperbaric oxygen chamber because recompression therapy restores normal blood flow and oxygen to the affected tissues. On an airplane, barotrauma to the ear, also called aero-otitis or barotitis, can happen as the plane descends for landing. You've probably all experienced this. It can create pain and hearing difficulty similar to the middle ear infection. The eardrum can rupture in severe cases of ear barotrauma, causing bleeding or leaking of fluid from the ear. Remember those 3 gas laws we spoke of earlier? Okay, let's get really deep here and see how they interface with what we're discussing. Boyle's law, Boyle's law, at a constant temperature, the volume of gas is inversely proportional to the partial pressure of the gas. These are test questions. So here's a scuba diving example. If the diver holds her breath as she ascends, the air in her lungs will expand as the pressure from the water decreases. This expanding air has nowhere to go, so it can rupture the alveoli in the lungs. This could result in an arterial gas embolism, a serious medical condition where air enters the pleural space. And how about Henry's law in scuba diving? At a given temperature, the amount of gas that will dissolve in a liquid is directly proportional to the partial pressure of the gas. So when the ambient pressure is increased with depth, the partial pressure of oxygen and nitrogen in the body rises. There will be more molecules of each gas dissolve in the blood and tissues. So nitrogen will remain dissolved in the blood as long as the partial pressure remains the same. If you ascend too quickly, bubbles can form, and bubbles in the bloodstream can obstruct airflow. Come on, this is exciting stuff, guys. Come on. Okay, remember Dalton's law? The pressure of a mixture of gases is the sum of the partial pressure of all the gases in the mixture. This means that the deeper the diver goes, the more nitrogen and oxygen the diver is breathing because the water pressure is denser. Okay, now let's get to more mundane topics like swimmer's ear. It's a bacterial or fungal infection in the outer ear canal, and you may have had this when you were kids. It runs from your eardrum to the outside of your head. It's often brought on by water that remains in your ear after swimming, creating a moist environment that aids bacterial growth. Common treatments are to use vinegar and or alcohol or hydrogen peroxide drops in the ear canal. We would probably see this around swimming pools and lakes when a young person typically tries to dive deeper or hold his breath longer. This can be considered intentional hyperventilation, which decreases the amount of CO2 in the body. Remember that the presence of CO2 causes us the stimulus to breathe. It's not oxygen, it's CO2. If our swimmer loses the stimulus to breathe and they're in the water, could drown. We think of trauma most often in diving accidents causing neurological injuries to the cervical or thoracic spine. Soft tissue injuries are the most common when a person falls or encounters rocks or sticks. There can be an orthopedic injury like fractures or joint dislocation in water sports. Deceleration injuries associated with motorized sports happen as well. Okay, this illustration shows a strainer injury where a person is injured by striking objects below the surface of the water and from twisting caused by currents under the water. How are you going to help this guy? The water's flowing that way, he's stuck. In different bodies of water in the world, we know that aquatic animals are present that can harm a person in the water. There are obviously shark bites, sea urchins, and jellyfish stings that can inflict neurological, cardiovascular, and dermatological injuries. No doubt you can think of a variety of animals that can cause harm to the unsuspecting person in open waters. As ski patrollers and OEC technicians, we want to help people prevent emergencies, and this includes preventing water emergencies. If you see something unsafe, do something about it to prevent injury or death in the water, because diving, swimming, kayaking, and whitewater river rafting can be strenuous and therefore increase the metabolic demands on the body. Water-related injuries can be more severe when there are underlying medical conditions. Think about conditions like diabetes, heart disease, or asthma, to mention a few. Note the bullet points on page 931 of the text and incorporate them to prevent water-related injuries. They are common sense warnings, but some are not acknowledged, like wearing personal flotation devices and avoiding alcohol in the water. Okay, in our case update, you're going to assist our patient from the water while maintaining C-spine precautions. You direct some of your companions to summon help and then immediately begin rescue breathing using a pocket mask. Keep going over that. Excuse me? Okay, we're going to keep going. All right. Okay. All right. Okay. Oh, good. Okay. So I have these here. Okay. Okay, so I'm going to, oh,